DocTalk is brought to you by Multimin USA, manufacturers of Multimin 90, sure trace mineral supplementation by timed injection.
Hi there and welcome to DocTalk. I'm Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University, and I'm joined by Dr. Beth Davis today. It's going to be a great show. We're going to talk about equine vaccination programs and why you should vaccinate your horses. We're sure glad you joined us.
We started using Multimin 3 or 4 years ago. Anytime that you're able to supply a product like this that can boost the immunity system, get a better response from your vaccines, it kind of fits into a total program. We just feel like that the Multimin is kind of a reassurance that we're getting the most and the best performance possible.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment is brought to you by Lalaman Animal Nutrition, dedicated to the development and production of natural and differential solutions for animal nutrition.
Hi there and welcome to DocTalk. Dr. Davis, thanks for being here.
My pleasure. Thanks for having me.
For those of you who haven't met Dr. Davis, Dr. Beth Davis is an associate professor here in the Department of Clinical Sciences, and she's a boarded internal medicine specialist for large animals, and specifically you work with horses here at the Veterinary Health Center at Kansas State University. But it's always great to have you on the show, great to talk about horses, and today we're going to talk about vaccinations.
Perfect. That sounds like a great idea.
All right. Well, let's start out with the big question is, you know, should I vaccinate my horses? Why should I vaccinate my horses?
Yeah, great question. And, you know, that is an issue that comes up is, do we really need to vaccinate our horses? And when we're looking at preventative health and keeping our horses healthy and trying to avoid complications and sometimes pretty serious complications of infectious disease, vaccines are going to be the core way that we are going to protect those horses.
And so, you know, when, you know, and I've sure you get those questions.
Absolutely.
And people are you have the two camps, the one that want to vaccinate for everything under the moon, and the others that need to figure out they need to get them involved. So when we're talking about different types of vaccines, how do we break those down or classify them?
Right. So according to the American Association of Equine Practitioners, we have two categories of vaccines. We have those core vaccines, and then we have risk-based vaccines. And the core vaccines are really intended to protect against those very serious pathogens that could cause very serious disease, even disease that could kill our horses. And so those diseases are going to be things like the encephalitis viruses, Eastern, Western, West Nile encephalomyelitis viruses, tetanus, and rabies. Those are going to be really important.
So the core vaccines are really the vaccines that are, you know, regardless of where you live, regardless of the production status of the horse, these are the ones that, you know, you really got to get done. Regardless. Absolutely.
And and so something like rabies, it's really important for the horse, but it's really important for the people working around that horse as well.
Yeah, it can be issues not only with your companion animal or large animal, but also something that human beings can contract. So when we start to think about the core-based vaccines, you know, those are there are 4 or 5 that you're recommending. Is there a time of the year in which you recommend that you give those?
Right. So those are going to be vaccines that are started when the horse is young, and usually with an initial series of 2 to 3 vaccines, depending on how old the horse is. If it's the first year of life, series of 3 vaccines, and then an annual booster, and that booster is often going to be given in the springtime months. You know, it needs to happen at least once a year, though, to keep them healthy.
Perfect. It's a great discussion on equine vaccines. When we come back after the break, we're going to have more discussion with Dr. Davis on the equine vaccines. You're watching DocTalk, and we're sure glad you joined us.
This segment was brought to you by Brute Cattle Equipment, makers of the Brute Stealth Hydraulic Chute. If the chute fits, swear by it. Visit our website for more information. Beef producers need a practical choice when antibiotic therapy is required. More than ever, they are reaching for non-prescription Noromycin 300LA from Norbrook, specially formulated to produce sustained antibiotic blood levels up to 4 days in cattle. Noromycin 300LA delivers economic, broad-spectrum disease management for pneumonia, shipping fever, pink eye, wound infections, and foot rot. See for yourself why Norbrook's Noromycin 300LA is the practical choice for your herd.
Dr. Dan here. Whether I'm driving up and down the roads covering the state of Kansas or I'm getting between Riley and Manhattan for my job, I'm driving a Ford truck. I'd like you to come out and visit my friends here at Dick Edwards Ford. They have a truck that'll suit your needs, whether you're looking for power with a Power Stroke diesel or if you're looking for fuel efficiency with the new EcoBoost engine, they got a truck that's just right for you. They're located 2 miles east of the Town Center Mall in Manhattan, Kansas, and they'll bend over backwards to help you. And I'll see you down the road.
Got cattle? Rotomix manufactures a complete line of energy-efficient rotary and vertical feed mixers for feedlots, beef production, dairy, and cow-calf operations. Our mixers are available with the patented Generation 2 staggered rotor, the industry standard for feeding wet rations that include wet distiller's grain. Made in the USA, Rotomix mixers are designed for feeding performance that American cattlemen and dairy producers have come to expect. Rotomix, proud to offer a better mix in less time using less fuel.
This hog is head over hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
This segment is brought to you by Purple Wave Auction, the easiest, most straightforward way to sell used equipment. Purple Wave, straight, simple, sold.
Hi there and welcome back to DocTalk. I'm Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University, and I'm joined by Dr. Beth Davis, who is a boarded internal medicine specialist for large animals, and she's an associate professor here in the Department of Clinical Sciences at Kansas State University, and we're talking about vaccinating your horses.
Yeah.
We've established the fact that we need to. We've established the fact that we have core vaccine strategies for all horses, and now we're going to talk about risk-based vaccines. Why do they call them risk-based?
Right. So risk-based vaccines are going to be really important for diseases that the horse may develop depending on their environmental conditions.
Okay.
And so any horse owner is going to work really closely with their veterinarian to make specific vaccine decisions. But these risk-based vaccines are targeted towards things like respiratory disease. So those viruses like influenza virus, equine herpesvirus that cause respiratory disease. There's a variety of vaccines to choose from out there and different types of vaccines. Some are going to be in the muscle, some are going to be intranasal. And again, working with your veterinarian, owners can make those decisions, but it's going to protect against those diseases that might be encountered by the horse.
Some of those intranasals can be a little bit of a test to deliver sometimes.
That's right, that's right. They can be a little tricky. Yep.
When we're talking about, can we get into maybe some of these specific risk-based vaccines as far as maybe the more popular ones and why we do some of those?
Right, absolutely. And so influenza. Influenza is a virus that is in the horse population. It is everywhere.
Highly contagious.
Highly contagious. It's going to spread through a barn of susceptible horses if they're not vaccinated. It's going to cause fever, coughing, nasal discharge. Horses aren't going to be able to go to the horse show or go and race. They're not going to be able to perform if they're sick with influenza. So it's important that they're vaccinated against influenza. Even though it may not threaten their life per se, it certainly is going to be highly contagious, spread through the barn, and performance limiting. Along those lines, another one is equine herpesvirus.
Okay.
We have a couple different kinds of equine herpes viruses. Type 1 and type 4 are the ones we worry about in terms of horses developing respiratory disease. So it's really important that horses are well vaccinated against EHV 1 and 4 to protect against respiratory disease. EHV1 can cause problems in pregnant brood mares, and so we can have problems with abortion. So in pregnant mares, it's important that they are properly vaccinated against EHV1.
Wow. Now, can you give that vaccination to them while they're pregnant, or is this something that
Right. So good question. Again, it's something that the owner's going to work with the veterinarian on. But yes, those mares, those pregnant mares, do need to be vaccinated throughout pregnancy so that we can maintain a high level of immunity against that virus and we don't have problems with abortion and even abortion storms. Another important bacterial disease that can cause respiratory disease that would fall into the category of risk-based vaccines is the one that protects against strangles or Streptococcus equi. That is one that causes pretty serious disease, but only in certain populations of horses. And so that's one we really do reserve for horses that are only at risk for getting exposed.
I think it's a great discussion. We're going to come back after the break and continue our discussion on equine vaccines.
This tip brought to you by Baytril 100 Enrofloxacin Injectable, now approved for use in controlling BRD in high-risk cattle. Baytril 100, right the first time, whether it's controlling BRD in high-risk cattle or treating BRD.
Hi folks, welcome to the Farm Animal Tip sponsored by Bayer Animal Health today, and we're going to talk about fly prevention. Why is fly prevention important to you? 2 reasons. 1, disease control, and 2, performance. Flies can take pathogens from farm to farm, whether it's pathogens that may cause disease in cows or foodborne pathogens such as E. coli. And then production, biting flies and things to that nature have been shown to decrease the performance of the cattle within your herd. So controlling flies, we want to make sure that we get rid of vegetative places of rotten material, cut down the weeds so that they don't have a place to nest, and then you want to use a good fly bait or some sort of control. Work with your local veterinarian to design a plan to decrease flies on your farm this summer. And you've been joining me for the Bayer Animal Health Tip of the Day. Thanks for joining me.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Paxton Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
American innovation is being driven in places you might not expect by people like Brent Hayek, an Oklahoma family farmer, who recently set a world land speed record in a Ford Super Duty pickup truck powered by renewable B20 biodiesel. Advanced performance is here, now, putting America on the fast track to more jobs and energy independence. Biodiesel, America's advanced biofuel.
Got cattle? Rotomix manufactures a complete line of energy-efficient rotary and vertical feed mixers for feedlots, beef production, dairy, and cow-calf operations. Our mixers are available with the patented Generation 2 staggered rotor, the industry standard for feeding wet rations that include wet distiller's grain. Made in the USA, Rotomix mixers are designed for feeding performance that American cattlemen and dairy producers have come to expect. Rotomix, proud to offer a better mix in less time using less fuel.
Getting ready to work cattle for pre-breeding and calf vaccinations? There's no better time to use a safe, modified live virus vaccine to prevent BRD. Titanium provides the correct equation for BRD with its excellent safety profile and a strong response and long duration of immunity. Ask your veterinarian about modified live virus vaccines and the 8 convenient combinations of titanium for the perfect pairing of performance and value.
This segment is brought to you by Norbrook Laboratories, manufacturers of Normycin LA, Normectin Plus, 1%, and Poron, the practical choice for your herd. Hi there and welcome back to DocTalk. I'm Dr. Dan Thompson from the College of Veterinary Medicine at Kansas State University, and I'm joined by Dr. Beth Davis, who is a boarded internal medicine specialist for large animals and an associate professor in the Department of Clinical Sciences here at the College of Veterinary Medicine at Kansas State University. And Beth, you see a lot of horses coming in through our clinics, whether it's for referral from all over the United States or our local horses that use us as a local practice. Y'all are to be commended for the level of care that you give to a lot of horses, and it's great to have you on here. We're talking about vaccinations, and as we had discussed kind of before the show, you know, sometimes there can be downsides to vaccines, and people need to be aware of some of the things that those can be. Absolutely.
It's an important point. Certainly there's not anything we administer to our animals that couldn't potentially cause a problem or have a downside. And so that's one of the reasons it is important to work with a veterinarian on making vaccine decisions. But some of the things that we can run into as far as a potential downside, in the last segment we talked about risk-based vaccines, and one of the vaccines I talked about was the one that protects against strangles. And strangles is a really important infectious disease, and certainly we want to protect horses against it, but sometimes we can have problems with that vaccine where they could actually develop some lower limb swelling, a fever, and actually get a little bit sick from that vaccine, which can be pretty serious. And so sometimes there can be adverse reactions from vaccine administration. The other thing that we can sometimes run into is we have a lot of vaccines that we've talked about, right, and sometimes time is tight for everybody and we try to be efficient with our time, and sometimes we give a lot of vaccines at one time to horses. And so in some cases horses will get a swelling or a stiffness or have a little bit of a couple of days where they're a little bit off after vaccination. And so in those situations we do want to try to spread things out a little bit, again working with the veterinarian, but using a strategy that does kind of spread it out and maybe doing it over the course of weeks or months to complete that vaccine program.
So if I get the lower limb swelling and some of these things that could potentially happen, you know, I know I should probably have a veterinarian take a look at the horse, right, but what are some of the things that a veterinarian is going to be looking for or thinking about right, with getting my horse back to normal?
Right,
Is it
right.
just a time?
Well, it depends. It depends on the vaccine that was administered, and it depends on the kind of reaction that we're seeing. And so if it is a situation where a problem after, say, a Strangles vaccine, that can be a pretty serious problem. And so they're going to be looking specifically for how the horse is doing and then giving specific anti-inflammatories to help reduce that reaction.
Get rid of the swelling.
Yep.
Yeah. Well, I think it's important. I think that when we come back, we're going to take a break. Okay. But when we come back, maybe have a discussion on how we plan our vaccine programs out.
Okay, that sounds terrific.
Sure appreciate you joining us.
All right, well, thank you.
We appreciate you joining us too. We'll be back right after the break. You're watching DocTalk, and we're sure glad you joined us.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
A K-State animal scientist had the opportunity to speak at the Southern Plains Drought Summit in Pratt, Kansas. With Ag AM in Kansas, I'm Devin Stewart. Justin Wagner says that as producers plan for the upcoming grazing season, with the prospect of continuing drought conditions, producers should consider the merits of supplemental feeding cattle on drought-stressed pastures.
The key thing to focus in on is that our primary need to cows on drought-stressed pastures in a limited forage availability situation is really energy instead of protein. And so that changes the picture in terms of how we price our supplements. You know, they need to be priced on a cost per unit of TDN or a cost per unit of net energy for maintenance value as a way to compare a number of the different supplements.
With Ag AM in Kansas, I'm Devin Stewart.
Cow-calf, stocker, and feedlot producers know that effective parasite control improves overall herd performance and profitability. Norbrook offers a comprehensive, economical line of pour-on and injectable parasiticides for every livestock operation. Consult with your local animal health supplier to set up a program that protects your investment and brings larger cattle checks this fall. See for yourself why the Noromectin line from Norbrook is the practical choice for your herd.
The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production.
Getting ready to work cattle for pre-breeding and calf vaccinations? There's no better time to use a safe, modified live virus vaccine to prevent BRD. Titanium provides the correct equation for BRD with its excellent safety profile and a strong response and long duration of immunity. Ask your veterinarian about modified live virus vaccines and the 8 convenient combinations of titanium for the perfect pairing of performance and value.
This segment is brought to you by Rotomix, manufactured in the USA and designed for feeding performance in the feedlots, beef production, dairy, and cow-calf operations.
Hi there and welcome back to DocTalk. I'm Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University, and I'm joined by Dr. Beth Davis, who is a boarded internal medicine specialist for large animals and an associate professor in the Department of Clinical Sciences. And we talked during the break, you know, kind of that timeline. What for an adult horse, what are your thoughts? Of course, we recommend to work with their local veterinarian.
Right,
But
absolutely.
let's just talk in general terms what you kind of look at as a veterinarian.
Sure. So the way we look at it is going back to those core vaccines, and so protecting against disease that, number one, can be life-threatening and can be contracted through things like mosquito bites. And so when we have warm weather, we want to start up with those vaccines early in the year. So we're probably looking somewhere around March to start with those vaccines, so Eastern, Western, West Nile, tetanus, rabies. With our risk-based vaccines, and we talked about influenza and rhinopneumonitis, so respiratory diseases that horses can come in contact with, we're going to include that at that time as well. We're going to vaccinate against those. And that's going to allow that horse to have time to induce an immune response, be well protected when they are exposed to other horses at activities, at trail rides, at shows, those sorts of things, and then as well as be protected when they get those mosquito bites and potentially are exposed to those viruses.
It's absolutely amazing how many times a horse can be bitten
Absolutely.
by a mosquito in a day.
Yeah, exactly, and especially at night, and especially at night in very warm weather. We have a lot of problems with amplification of those viruses when we have real warm nights. And so that's another reason we want to make sure that they get the vaccines early enough that their immune system is really cranked up when they're staying outside 24/7 because the weather is beautiful and it's nice and warm, but they are getting those mosquito bites. And then when we get a little bit later in the year, so we get through our summer months and we're moving towards fall, then we want to go ahead and give them a boost for respiratory viruses because, again, through the winter months, they can get exposed and they can have problems. Some of those vaccines don't give them year-long protection, so we want to boost them again for flu, for rhino, again in the fall months.
So for a majority of them, it's going to be an annual booster in March, and then your flu and your rhino heading into that kind of flu season, even though they're horses. You know, we're going to be looking at a booster at 6 months.
Right, exactly. And depending on where they live, there's going to be modifications based on season and that sort of thing.
I get a lot of questions on the strangles and the rabies. Are those annual generally, or?
Well, the rabies is a once a year. It's a really good, potent vaccine, so that's a once a year, and we're doing that one in the spring. The strangles, again, in those individuals that need it, that is actually going to be a twice a year vaccine.
So as we're moving towards show season and things like that, probably need to booster them every 6 months.
Right, yep, absolutely.
Excellent. Thank you so much.
Well, my pleasure, thank you.
You always do a great job, and really appreciate what you do for our students and for our clients.
Well, thank you very much.
And thank you for watching DocTalk. It's been a great show today. If you want to know more about what Dr. Davis and I do here at the College of Veterinary Medicine, you can find us on the web at www.vet.ksu.edu. Remember, we encourage you to always work with your local practitioner, and thank you so much for watching the show. Again, I'm Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University. You've been watching DocTalk. We're sure glad you joined us, and we'll see y'all down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
DocTalk, produced in cooperation with Drovers Cattle Network and Bovine Veterinarian. For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Multimin USA, manufacturers of Multimin 90, Sure Trace Mineral Supplementation by Timed Injection.
Jason Lewis. I work here on Division Ranch, north of Strong City, Kansas. We run 500 head of mama cows. We started using Multimin about a year ago. We didn't have any problem with health that year. Didn't have to doctor near as many in that pasture. Just the overall appearance was a lot better. And I liked it so well, we'll start using it on everything.